Good afternoon. I am Andrés Latorre, postdoctoral researcher at Norton Thoracic Institute in Phoenix, Arizona. I would like to present our project entitled Exploring the Role of Non-Invasive Biomarkers of GERD-induced Pulmonary Injury. I do not have disclosures. However, I would like to thank SAGE's Research Committee for the 2023 Research Grant Award that was given to support this project. As you know, there is increasing recognition that pulmonary conditions such as chronic cough, asthma, IPF are related with GERD. Moreover, early diagnosis of these conditions is really challenging because unusually asymptomatic progression until very advanced stage of the diseases. Also because there are not available diagnostic non-invasive methods. However, our group has proposed a novel pathophysiological model on how GERD may facilitate lung damage via an immune response. This model was developed in the lung transplant setting. In brief, once the gastric contents reach the alveoli, it causes mechanical damage to the respiratory epithelium, and this exposed to normally self-sequestered antigens, namely collagen 5 and K-alpha-1 tubulin. Once this happens, the immune system recognizes those antigens and targets them, generating an immune-specific response against them. What happens after is that the immune response facilitates lung damage via fibrosis. In lung transplant patients, that cause development of chronic lung allograft dysfunction. However, we believe that this pathophysiological model can be translated to the non-lung transplant setting. Hence, we believe that the measurement of these antigens contained in a small extracellular vesicles circulating in serum, as well as the corresponding antibodies, they are markers of active pulmonary parenchymal damage in patients with GERD. Our aim was to determine whether increased serum levels of these antigens or antibodies occurs in a murine model of lung damage secondary to aspiration. We conduct a preclinical proof of concept study using an experimental murine model after localized Cook approval. For this model, we use a total of 36 mice and 4 experimental groups. The first group underwent aspiration of hydrochloric acid. The second group underwent aspiration of human gastric contents. The third group underwent aspiration of a mix of both substances in a ratio 1:1. And within each subgroup, we had also, within each group, we have also subgroups that underwent different frequencies of aspirations between day 0 to day 35. Moreover, we had a 4 experimental group that served as a control. We were able to take blood samples to measure concentrations of those specific antibodies during the pre-specified time points and also at day 90 with the sacrifice of the animal. Also, at day 90, we were able to measure antigens and also assess the histopathological assessment for the lung tissue or the lung sections. This is a cartoon that presents how we aspirate the mice. This is the summary of the procedure. Basically, we use a modified otoscope and we intubate the mice using a 20G catheter, and through the catheter, we flush the required substance, and after that, we flush air to clear the substance and make sure that the aspiration goes into the lungs. Of course, don't be worried. This is under light sedation, so the mice doesn't feel any pain at all. The measurement of antibodies, we use a laboratory technique that is called ELISA. For measurement of antigens, we first filter the small EVs, or formerly called exosomes, and we prove the antigen expression using Western blots. And for histopathological assessment, we study lung sections with conventional stains and also with immunohistochemistry. As you can see, there was a clear impact of aspiration in the short term in those mice that were aspirated because we observed a decrease of the weight within the first 14 days, but also we saw a clinical impact in the long term because mice that were aspirated did not gain the same weight as the control groups. Moreover, when we perform an analysis by subgroups and frequency of aspirations, we observed that all mice that were aspirated had worse weight gain compared to the control groups. In terms of induction of the antibodies against collagen 5, we did observe higher concentrations among those mice that were aspirated at day 28, day 35, and day 90. And also we observed a trend towards increasing concentrations of antibodies against collagen 5 over time compared to the control group. In terms of antibodies against K-alpha tubulin, we did not observe a significant statistical difference between aspirated mice and controls at any pre-specified time point. However, we also observe a trend towards increasing concentrations of these antibodies over time among aspirated mice. In terms of expression of the protein in the extracellular vesicles, we did observe, again, higher mean optical density in terms of collagen 5 among aspirated mice. However, we did not observe any difference between the control groups and the aspirated mice in terms of K-alpha-1 tubulin. By the analysis, by type of substance that was aspirated to the mice, we observed the higher mean optical density radius among those mice that were aspirated with hydrochloric acid or human gastric contents. In the histopathological assessment, we clearly observe loss of alveolar spaces and also increase of alveolar thickness among mice that were aspirated a higher number of times compared to the control groups, regardless the type of substance that was used. Also, in the graduation of the fibrosis, we observed at day 90 early signs of fibrosis among those mice that were aspirated 3 or 6 times. Moreover, we observe higher counts or infiltrations of CD3 T cells among all mice that were aspirated, regardless the type of substance or the type of aspiration. In our correlation analysis, we confirm that there is a positive, strong correlation between the expression of antibodies against collagen 5 and the infiltration of CD3 cells in lung parenchyma among those mice that were aspirated. Also, we observe a strongly positive correlation among the concentrations of collagen 5 in small extracellular vesicles and the loss of alveolar spaces and also the increase of alveolar thickness. Of course, our study has some limitations. First, it's a relatively small sample size. We also had a learning curve for the development of this mutant model. We were not able to evaluate the histological lung sections after acute aspiration. We also did not have enough time to create a mature fibrosis in the pulmonary tissue, and the pulmonary function of the mice was not evaluated at this time. Of course, also there is an individual immune response that happens in each animal. In conclusion, we were able to develop a mutant model of lung damage secondary to aspiration. We confirm that aspiration leads to a specific early immune response. We also were able to document that higher concentrations of collagen 5 in small EVs as well as antibodies against collagen 5 occurs, and they correlate with lung damage, early fibrosis, and T cells infiltrations among mice that were aspirated with acidic contents. And of course, the measurement of these humoral factors may serve as non-invasive markers of GERD-related lung injury. I will be happy to take any question, if any, but not less important, I would like to thank all the persons that believe in this project and also support them, especially Dr. Mithal, my mentor and PI. Thank you.
Thank you.